The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. This weekend, people gathered at the Cape Breton County Exhibition Grounds to raise their concerns about the closures of community hospitals in the CBRM. Unfortunately, the minister was unable to attend. I wonder, would he have rearranged his schedule had he known that more than 400 concerned citizens would show up looking for someone they could hold accountable for this decision? Mr. Speaker, what is the minister's excuse for ignoring the citizens of Cape Breton?
The Honourable Minister of Health.
Thank you, Mr. Speaker. What we're doing from a healthcare perspective in the Cape Breton region is well known. Mr. Speaker, we are investing in that region. We are revitalizing the infrastructure for our healthcare system in New Waterford and North Sydney, Mr. Speaker, providing new primary healthcare facilities where citizens will receive primary healthcare services. They'll continue to receive blood services, Mr. Speaker, x-rays and other healthcare services in those facilities. We're nearly doubling our long-term care access in those communities, Mr. Speaker. We're expanding our emergency room and doubling the size of our cancer care centre at Cape Breton Regional, Mr. Speaker, and expanding services in Glace Bay as well.
The Honourable Minister of Health has the floor.
So, Mr. Speaker, I categorically disagree with the member's suggestion that we're ignoring Cape Bretoners. In fact, we're investing in healthcare for Cape Bretoners.
The Honourable Member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, I applaud the minister's response because if you categorically disagree, then you should probably watch, or the minister should watch the video where doctors describe at the meeting in North Sydney just how they were not informed or included in the decisions, and they completely disagree with you. Mr. Speaker, this past weekend, emergency rooms in New Waterford and North Sydney were closed again. Residents are frustrated, and for good reason. They've been asking for answers and they're getting silence. We are not getting new beds. We are not getting one new bed in the emergency room in the Cape Breton Regional Hospital, and we all know that. Mr. Speaker, I'd like to ask once again, with the minister having enough notice to free your schedule, will you come to New Waterford to consult with the residents on the closure of their hospital on October the 14th and actually listen to their concerns?
The Honourable Minister of Health.
Thank you, Mr. Speaker. First, as the member would know, and we've been very clear since we made the announcement in June that, in fact, the next phase, which is underway of this revitalization process, is to do the functional plan. Based on the member's comments, I'm not sure if she's received a copy of that plan, because I certainly haven't, Mr. Speaker, for her to make accusations and conclusions that simply haven't been there. The suggestions around expanding emergency.
The Honourable Member for Cape Breton Centre will come to order. The Honourable Minister of Health.
That would be, Mr. Speaker, her conclusion that there would be no changes or expansion in the emergency departments, Mr. Speaker. That's exactly what the functional planning process is all about.
Order, please. The Honourable Member for Cape Breton Centre will excuse herself for the balance of question period. The Honourable Minister of Health.
That's exactly what the functional planning process is about, Mr. Speaker. That work is underway. That's where consultation is taking place, Mr. Speaker, to understand the impacts and the opportunities to properly design these facilities in New Waterford, North Sydney, as well as Cape Breton and Glace Bay to improve the future of healthcare for all Cape Bretoners.